Three.
Okay. Today I wanted to share some techniques and concepts around freeing the lungs and bronchi and thoracic cavity. These are especially useful for anytime after bronchitis, pneumonia, people that have had a lot of lung congestion secondary to COVID, people that have been intubated. All of these things, these techniques will be really useful. So often I would start, or we'll start just freeing up the diaphragm. Just literally, you can feel here, you can feel the ribs, the lower ribs give. And when you find that density here, you're on where the diaphragm attaches to the rib cage. I like to come from inferior to superior because it's domed. And so I'm following the angle of the dome. And so I'll stay here until that gives us some release. This gives us some, helps adjust the thoracic pressure. I'm going to move through this. Okay, there's a little bit of tension here on the right around the liver, and of course there are a lot of relationship between the liver and the diaphragm as well. But the diaphragm, of course, if there's a lot of coughing or congestion, it gets aggravated. The diaphragm is innervated from the phrenic nerve, which comes down off the cervical plexus, runs down here, and then innervates the diaphragm, and also has some branches that go to the gallbladder. You can begin with the thoracic cage, and remember that the intercostal nerve has a connection with the sympathetics via the ram-like communicants. So it actually, that nerve through the ribs is one of the reasons that ribs can be so painful, I think, is because of that connection to the sympathetic chain, sympathetic ganglia. Remember your sternum, the sternum, so we can work the lower sternum. And then we have the manubrium. And often this is involved, and we can get some leverage on the ribs this way, like this coming inferior here into, you could think of it as flexion of the sternum. And I can kind of, if you want to call that a myofascial release or whatever, but I'm really thinking of the cavity here. So superficial. Yes, there's some compression, but I'm thinking of the bony cavity here, of the bony cage, excuse me, not so much the contents. So that's softening a little bit in relationship through the costal chondral cartilage there. There we go. And then I'm going to come to this side. Did you feel that little? Yeah. Remember, you have the mediastinum here, kind of this region where there's a lot going on with the heart and the lungs, the pulmonary circulation, the bronchi. So that, and the pericardium comes down, and the pericardial ligament attaches to the diaphragm. So you have that relationship with the breath. And that can be useful to get the diaphragm here. So initially we release the diaphragm this way, but I can get hold of the diaphragm and work that ligament that's between the pericardium and the diaphragm right there. It has a very distinct feel. Just stay with that just a moment. And basically just in this case I'm following what the body wants to do. There we go. That was a nice little release for what is just really a demonstration. Now remember that the trachea is in front of the esophagus. So we can do some work here, even through the throat, but staying with the thorax here, that'll be the first tube that you run into, if you will, that you feel. The esophagus is soft, of course, and it's behind it. So that first tube, and it's kind of a little fibrous, especially as it goes into the bronchi. You can tell the bronchi because they're more fibrous than the lung tissue themselves. So first, what's often useful is to feel the glide of the pleura. So you have the thoracic cavity, the thoracic rib cage, and then you have the pleura, and then the lung underneath. And in this case, we're talking about the bronchi that are feeding into the lung. You usually feel a pretty distinct angle here, for example, here. There she goes, bronchial tree. Coming up to the other side. Good. Good. So here's how you can catch some of the pleura. So if I'm more superficial, you probably can tell. So here was the rib cage or the sternum. Here I'm actually kind of backing off a little bit and going in between that layer. I'm going to go to the layer underneath the bony cavity, the bony cage, excuse me. Right there. Good. Good. Can you pause that?